Good evening. My name is Ray. I'm a nurse practitioner student. And your name, ma'am?
Amber.
Amber. Nice to meet you, Amber. So today we're going to be doing an assessment on the skin, hair, and nails. First of all, I want to start off by asking, Miss Amber, are you comfortable? Is it warm in the room? Is the temperature okay for you?
That's fine.
Okay, good. So before I start the assessment, I'm going to wash my hands real quick, and then I'm going to put on some gloves, and then we'll continue on with the assessment. Okay, I got my gloves on. Want to make sure we keep it clean here. So the next thing I'm going to start off with, I'm going to look at it, do an overall view of Miss Amber's skin. As I'm inspecting the skin, I'm looking for any discolorations in the skin. I'm looking for any moles or lesions of the skin. I'm going to take a look at her feet as well. Looks clear. Okay. Look at the other leg here. Skin looks clear. Okay. And then also, I want to make a point to where while I was doing my inspection, I did notice a mole on her arm there, but I'm going to take a further investigation on that. And right now, I'm just going to look at her overall skin, make sure. Sometimes when you look behind the ears, you may spot some lesions or things of that nature in the back of the ears. Okay, it looks clear. All right. So the next thing I'm going to do, I'm going to check the temperature of her skin. I'm checking the temperature of her skin right now. And it's warm. I'm going to check her legs. Legs are also warm. Feet are warm. Okay, switch the other hand here. Check her skin on her face there. Neck and chest, shoulders. It's also warm. Okay. Before I continue on, I'm going to take a look at the mole. Now, in the beginning of the assessment, she made it known to me that she had this birthmark since she was a child, and so I'm looking for any discoloration. I'm also looking for any abnormal borders around that area. And most moles, they need to stay below 6 centimeters. And I'm going to take a look at that with my magnifying glass. Okay. The mole appears brown. It's very small, and it looks like it's under the 6 centimeters. And at this time, I don't see any irregular borders or anything of that nature in that region. I'm also looking at the overall appearance of her, and I noticed that she's well kept. Her skin looks really clean. There's no odor. At this time, I don't smell anything that can be any signs of infection or anything of that nature. I'm going to ask Miss Amber to stand for me. And so we're going to take a look at her back region. And the same thing that I did in the beginning, I checked for temperature. I'm going to do the same thing on the back of her neck, on her back area. I'm going to be looking for any lesions or discolorations posterior of her back here. Everything looks normal in all those areas. Also looking for hair distribution around the body. And looks even, soft hair, skin smooth, and also no rough or dry patches on her skin. You can have a seat, Miss Amber. Okay. So at this time, I'm also going to check for skin turgor. Usually with skin turgor, if a patient is dehydrated or they have signs of edema, this in assessment it'll detect that. Skin turgor usually occurs showing that the patient is hydrated. You pinch an area of the skin and elasticity should go right back to the normal setting of the skin. And I'm pinching in different areas, her neck, chest, shoulders. I'm also checking the axillary area as well. I'm going to get her to raise her arm for me. Skin turgor there. And it's real clean under there as well. No odor. Same here. Good. I'm also going to check her legs as well. The skin turgor. No pitting edema or anything like that. Usually with pitting edema or in the leg area, usually indicates circulation issues in the legs or in the body. Okay, looks good. Okay. So the next thing I'm going to check, her hair, her scalp and hair. What I'm looking for a dryness, if she has any dryness of the scalp. I'm also looking to see if she has any sores in her hair. Usually in African American hair, we usually keep the scalp oiled and not dry. So you want to make sure that the hair is evenly dispersed across the scalp, and it's really well kept. I'm looking at the hair region here. And really clean. There's no signs of lice or infection in the scalp area. Really good. Okay. So the next thing I'm going to check, I'm going to be checking for her nail beds. In the nail bed area, I'm looking for clubbing. With clubbing of the fingernail, it's a raised area of the fingernail that occurs whenever you have cardiovascular issues or respiratory issues. Normal range for non-clubbing is 160 degrees. If it's more than 180 degrees, then needs further follow-up. Okay, so I'm going to give me my straight ruler here and check for clubbing on her fingers there. We'll check both hands. And both fingers are right at 160 degrees. Now I'm going to check the nail beds. I'm going to make sure that her fingernails doesn't separate from her fingers on all fingers here. Okay. While I'm doing that, I'm going to also check for cap refill. Cap refill shows good circulation if it's less than 2 seconds. Her fingernails are painted, but if you look at her fingertips, if the color returns back within about 2 seconds, then she has good circulation in her fingers, and her fingernails look really clean. There's no frays or anything like that, or swelling in the cuticle region. I'm also going to check for the same thing on the feet area. So I'm going to get her to raise her foot, and feet here. Also has cap refill less than 2 seconds. Also, while I'm doing this, I'm going to check her pulse. Pulse is regular and normal. No infection or fungi appearance of the nail bed. Also going to check the pulses of her hands here, of her wrists as well. And it seems to be steady and as well as normal. Okay. So again, I looked at the overall appearance of Miss Amber today, and her skin and everything seem to be evenly distributed. There's no lesions on her skin at this time. Also reassessed the mole that was on her left arm as well. And I think I'm going to ask Miss Amber, do you have any questions at this time?
No.
Okay, no questions. And thank you for joining us, and this will conclude the skin, hair, and nail assessment.